Hi, it's Nick from Nick's Nutrition, and this video is for you if you're either pregnant or if you're thinking about having a baby. Eating a healthy diet is super important at any time. However, it is vital for mums-to-be to allow your baby to develop and grow as it should and to reduce the risk of any complications. You don't need to go on any special diet, but you do need to pay attention to the foods that you're eating to ensure that you're eating a wide variety of nutrients for both you and the baby. So carry on watching if you want to see what my top 5 questions and answers are regarding diet and pregnancy. A healthy and balanced diet is essential, so it consists of a few things, and the first is eating plenty of fruits and vegetables. So ideally we should be eating a rainbow of different colours to ensure lots of different nutrients as well as fibre, which will help to prevent constipation. And when it comes to number of portions, ideally we should be eating around 5 to 9 portions, a portion being a handful, so about 80 grams. So on your plate you should ensure that you have a third of it covered with either leafy greens or salad or any types of vegetables, and then if you're hungry between meals or fancy a healthy dessert, then fruit should be the option. Another third of your plate should consist of protein, so either meat or fish, lentils or eggs. Protein is the building blocks of life, and these foods are fantastic for helping you to repair and helping your baby to grow. Just make sure that any foods that you eat, such as meat and eggs, are thoroughly cooked before you eat them. The final third of your plate should consist of whole grains or slow release carbohydrates, things like basmati rice, sweet potato or oats. These foods are fantastic for providing energy to sustain you throughout the day, as well as providing extra vitamins and also fibre. Sometimes throughout pregnancy you may suffer with nausea, and if you really don't feel like eating, then a smoothie can be perfect. So make sure that you're adding in things like milk and yogurt for both protein and some carbohydrate, as well as fruit. Another thing to think about is that if you are having cravings, are these cravings being confused with thirst? So make sure that you're keeping well hydrated throughout the day, and make sure that your wheat is a pale straw colour. There are a few things that pregnant ladies should avoid, and the first thing is too much caffeine. So caffeine is found in obvious things like tea and coffee, but also things like Coca-Cola, energy drinks and chocolate. In the UK, we recommend ladies to have no more than 200 milligrams a day, which is the equivalent of 2 mugs of tea, 2 mugs of coffee, or 3 drinks of Coca-Cola, and I'll link down below where you can find out more. Alcohol should also be avoided, so particularly in the first 3 months. If you do decide to drink after this, then make sure to drink no more than 1 to 2 units a week. And 1 unit is the equivalent of around 100 ml of wine, 25 ml of spirits or half a pint of beer. You should also avoid eating soft cheeses with mould, undercooked eggs or undercooked meat or fish, just because there's a risk of food poisoning. Regarding fish, you should avoid eating shark, marlin and swordfish due to contaminants such as mercury, and regarding fresh tuna, limit it to no more than twice a week, and canned tuna to no more than 4 times a week. For other oily fish such as salmon and mackerel, these are really good for your heart health, but you should have them no more than twice a week. It's unfortunately a myth that when you're pregnant that you need to eat for 2, and actually during the first 6 months of pregnancy your body doesn't need any extra calories at all. So in the last trimester, the last 3 months, your body needs around an extra 200 calories a day. So that's the equivalent of a bowl of fruit with yogurt, some toast with peanut butter, or a bowl of porridge with banana. Make sure that these 200 extra calories are really nutritious to help your baby to grow and thrive. In the UK, we recommend that ladies who are either thinking about having a baby or who are pregnant and up until the 12th week of pregnancy take a 400 microgram folic acid tablet to help your baby to be healthy, as well as a 10 microgram vitamin D tablet. There are pregnancy suitable multivitamins out there that combine both the folic acid and the vitamin D, and they don't have any added vitamin A because we know that too much vitamin A can be harmful to the baby. It's essential that you take your vitamins every day as they're prescribed, however they are not a substitute to a healthy and balanced diet. There's a really easy rule when you're trying to remember how much weight you can gain, and it's called the 1-2-3 rule. So if you're overweight, try to gain no more than 1 stone. If you are of a healthy weight, try to gain no more than 2 stone. And if you're underweight, then try to gain around 3 stone. It's best to avoid excessive weight gain in pregnancy, just to lessen the risk of complications and to help you to have more of a comfortable pregnancy. And it's also recommended not to lose weight intentionally. I really hope that you found this video useful. If you have, don't forget to give it a thumbs up and subscribe, and I look forward to seeing you next week.